I'm delighted to welcome back the friend of the show, Dr. Niall McCrae. Niall, welcome to the show.
Good morning again, David. How are you?
I'm doing well. It's bank holiday. Thank you so much for joining me on a holiday because you haven't decided to go and travel down to Cornwall or something and brave the traffic.
Well, it's raining again today, so I wouldn't have been going anywhere.
I know, a bit depressing, isn't it? Which is what you want to talk about. If you're depressed, you just do something that makes you happy. So do I. But some people seem to get they take these antidepressants, and it seems we have an epidemic now of people taking or being prescribed antidepressants. And you're looking at articles and writing about how these things are quite dangerous in many ways. What are the new thoughts on how these antidepressants can be dangerous to us?
Okay, well, the rise of the current class of antidepressants, which relate to serotonin, which is a neurotransmitter in the brain, they came about around the same time that I was doing my psychiatric nurse training.
Hmm.
And since the 1990s, their use has spread very, very rapidly. So that now, if you imagine yourself walking down a high street or in a cafe or on a bus, there's a 1 in 6 chance that the person sitting next to you or across from you is taking one of these drugs.
Wow.
And the thing is, they're called antidepressants, but they don't actually treat depression. Now, that might seem a very contentious thing to say, but the fact is that most people are taking these drugs for months, if not years. They don't come off them. And a large reason for that is serious withdrawal effects. It's very hard for someone to come off these drugs because their brain gets used to the sort of neurochemistry of being on these drugs, and it's very hard to come off them. And people can actually become suicidal or become very aggressive, violent. All kinds of nasty things can happen to people trying to come off them. So they just stay on them. And one of the reason that you and I, wanted to talk about this today is that just the other day there was an article in Daily Mail about how antidepressants are making people asexual, and this is something which is not it's not this is not new. It was always known
Mm.
that antidepressants cause impotence in men and frigidity in women, to use kind of
Wow.
traditional terms, but basically turn people off sex. And my argument, David, is a bit controversial, but my argument is that that's not just a side effect of these medications, that's actually the purpose.
Well, these are drug companies that have made them. They must have done some proper clinical studies, and when they do them, they have to look into all the side effects, and they must know. And it concerns me how they practice medicine and they practice science because they try to hide adverse health effects from the public and then just say, oh, well, this is good for this one thing, but then minimize the effects in other areas. But I mean, that's an extraordinary statistic you gave just then, that 1 in 6 people are on antidepressants. And then that's a huge number of people whose sex drive, if you like, is being suppressed. I mean, this goes along with so many other things that are sort of seeming to come together, coming at us in all different directions to stop us reproducing, and to depopulate the world. I mean, I don't think that's controversial at all. I think that's a very good question. You're analyzing the data and you're saying, well, this is a possibility and this really needs further discussion. Um, how could these things actually become so ubiquitous when probably there's a far, far better way to deal with depression, which actually gets to the root of it? But these things, they just seem to suppress the symptoms, but they don't deal with the root cause.
No, no, not at all. But interestingly, when Prozac came out, because that's probably the antidepressant that most people have heard of, that came
Mm.
out around 1987 and then rapidly spread. And Prozac was described by the drug companies as an empowering drug. And there was even a book out describing it as a feminist drug. These antidepressants were very much targeted at young women, women who maybe have successful careers. And the argument the drug companies were making is that everyone can have mental health problems, but mental health problems can all be treated, and this drug will allow you to carry on living your life, but living your life without having children, because the impact on sexual drive in women is it's a medical scandal. And you referred to research a few moments ago, David, and of course any drug coming onto the market has to be shown to be safe and
Mm.
effective. We know those terms well now, don't we?
Yes,
Safe
yes.
and effective. So in terms of, just very briefly, in terms of effective, the whole problem with the research on antidepressants is that while research does show some positive impact of these drugs, that is confounded by the placebo effect. So when
Mm.
people when they do a trial on any drug, they have people taking the substance and people not taking the substance, but it's blind, so that it's not known whether you're taking the active substance or the placebo. And what happens is that people get what's called the placebo effect in those trials. So if they start to get symptoms like a dry mouth and sweating, things that they're not used to getting, then they believe they're taking, and probably correctly believe that they're taking, the active substance. And that then influences how they perceive. Now, you remember with COVID vaccines, David, people would
Yeah.
say things like, "Oh, I've got a nasty headache after the injection," and they'd say things like, "At least that shows it's working." That is the placebo effect. Now, so that's the effectiveness. On safety, the big ploy of the drug companies with Prozac and Seroxat and all these other brands is to say that any adverse effect that people get while they're on the antidepressants is not because of the drug, it's because of the depression. You see? So, and this is all one big trick that's being played. And it's a massive, it's a blockbuster for the drug
Mm.
companies. And they're expanding use now to children. And I do think, and I'm glad that you didn't snap back at me when I suggested the depopulation agenda here, David,
Mm.
because it does seem to me that these drugs are doing a job. We know that there's a depopulation agenda in the powers that be, the globalists. We know that, and these 17 sustainable goals of the
Mm.
UN
Yeah.
Agenda 2030. I sort of wrote them as 17 unsustainable
Mm.
goals, because I think those sustainable goals are not about for the benefit of humanity. They're to reduce humanity, and
Mm.
I put in antidepressants as one of those 17 unsustainable goals.
Well, I mean, total fertility rate in the Western world is going down and down and down. I mean, I think in this country now it's below 1.6 for white women. For certain ethnic groups, it's much, much higher, 3 or 4. But certainly, the groups that would be targeted, women in their fertile age, as you say, I didn't know that it was marketed as something that was an empowering medication for feminists to take. I mean, that's completely twisting what it is to make you think, oh, this is great. I'm on Prozac. I've made it. This is what I do. I'm a powerful woman. I'm taking Prozac that helps me to power ahead with my career. I mean, if you sell it to women like that, then they're going to think, well, this is great. But this is a complete lie, isn't isn't it? Really, because you're going to have a lot of women who are going to end up childless, and this to me, from what you're saying, seems like just one of many things which are attacking our us as a society in many different ways. Look, I'm going to have to end in a second, but what can we do about it? What should we do to treat depression? Is there a better way than getting people on these SSRI antidepressants?
Pills are not the answer, David. Now, I'm not denying that antidepressants can do some good in the first few days. They help to settle the person. They've got some kind of sedative, anxiolytic effects, but they're certainly not antidepressants. That's a misnomer.
Right.
These drugs fit in entirely with J.D. Rockefeller's model of allopathic medicine, which is make everything, turn away from any natural cures, the sort of things that you're hinting at here, and make everything medicinal. And it's all about making women focus on their careers and turning their sexual drive off so they don't have children. That is the truth, and it needs to get out there.
Well, Niall, thank you so much for bringing that truth to us. You're always going to get the truth here on today's News Talk. And we'll be back after this break with our next guest. Thank you so much, Niall. This is today's News Talk, TNT.